Hi, welcome back to my channel. In this video, I will be talking about the Ansa cervicalis. Now, before we start the diagram, first of all, I just want you to know a few things about Ansa cervicalis. So, first of all, you should know that it is a thin nerve loop, alright, which lies anterior, which lies on the anterior wall of carotid sheath over the lower part of larynx. So what you mean by this is, suppose this is our carotid sheath, alright? Suppose this is our carotid sheath. Now, I'm sorry. Alright, so this is our carotid sheath. Now here you know that we have components, right? So this is our internal carotid artery plus common carotid artery. Then we have some vein, which is internal jugular vein. Then we have a nerve, which is our 10th nerve, which is our vagus nerve. Alright, then we have something here and we have two things here. Alright, something like this. So this is Ansa cervicalis, alright, on the anterior wall, and this is sympathetic trunk on posterior wall. Now a trick to remember, like often sometimes we are confused in exam whether it was external carotid or internal carotid. In all this, there is nothing which is of which has E in it. Okay, just remember this way. Everything does not have E, everything has I. So like that you can eliminate the options. Alright, then coming on to the diagram of Ansa cervicalis. Now it basically it supplies the infrahyoid muscles. So supplies infrahyoid muscles, which are a component of which triangle? You can comment that if you know. So now in this, so first of all, we have hypoglossal nerve. All right, now hypoglossal nerve supplies the muscles of tongue. All right, then we have a ventral ramus of C1, and it supplies two muscles, geniohyoid and genioid and thyrohyoid. Alright, then we have a descending branch and we have rootlets from C1 and C2. Alright, I'll label it first. So first of all, this is our hypoglossal nerve. Alright, and it is going to supply hypoglossal nerve is going to supply the muscles of tongue. So muscles of tongue. Then we have what we call is ventral ramus of C1, ventral ramus of C2, basically cervical nerve. Alright, so ventral ramus of C3. Now here you should know that the ventral ramus of C1 supplies only two muscles, and this is the question that is usually asked. So it supplies the so it supplies the geniohyoid and thyrohyoid. Alright, now this is our descending root, as you can see. So this is descendants hypoglossi. Alright, and this will supply the, this is the superior root. Okay, and we will two muscles here and then here. All right, so this is superior root. So superior root will supply the superior belly of omohyoid. Then we have sternohyoid and sternothyroid, and this is our inferior root of Ansa cervicalis, and this is supplying the inferior belly of omohyoid. Now let's talk about the questions. So first of all, you can get various questions. So starting from you can get key which nerve supplies geniohyoid and thyrohyoid. So you can't just say Ansa cervicalis, you will say C1 through hypoglossal nerve. Alright, then you can get the relation of Ansa cervicalis or sympathetic trunk with respect to carotid sheath. Then you can get a question on muscle supplied by Ansa cervicalis, okay, and so on. And according to inferior belly of omohyoid, this is the muscle which divides posterior triangle into two triangles, right? Remember, posterior occipital. All right, so this is the thing. Now from this diagram we will see like what I've drawn. So in this you will see this is our hypoglossal nerve and we have C1 here. All right, and now in this diagram it's missing, so we'll just write this is supplying muscle of tongue and this is supplying two muscles, geniohyoid and thyrohyoid, right? Then C2 and C3. Now these are supplying superior belly of omohyoid, sternum, inferior belly. Superior root is also called as, if you paid attention, it is also called as descent. Sorry, we'll just use some other color. This is not visible. So this is also called as descendants hypoglossi. Now there's a relation which you can remember. Superior root is related to the internal carotid artery and common carotid artery, whereas inferior root is related to the jugular vein. All right, so it's related to the jugular vein. Now this is like the cut section, and this is our Ansa cervicalis. Here we have C2 and C3A, all right, and C3B. So this is the core of Ansa cervicalis, and most of the questions will just come from this much part. If you like the video, do subscribe to my channel. Thanks for watching.